Sit around watching Star Trek a lot, live long and prosper.
That's right.
But I may not have gone to a lot of things, but I did go to my junior and senior proms. And I remember what it was like. I actually had a date. That was shocking in and of itself. But now these kids want to get back together for prom again and graduation and things like that. And man, that's packed with a little bit of controversy of how we do that in the age of COVID. And so today we have some great folks who are going to here to talk about that with us. Dr. Kenny Southwick, the Executive Director, Cooperating School Districts of Greater Kansas City. He's going to share the results of a survey he sent around regarding proms and graduation. We're going to hear from both sides of the state line. Dr. Joel Gilhouse, the Director of Secondary Schools for the Shawnee Mission School District, and Nicole Kirby, the Director of Communication Services at Park Hill up north of the river. They're going to talk about how they're going to handle this rite of passage.
Yeah.
But first, Hawkeye.
Yes.
Well, we're going to talk a little bit about J&J, but the numbers of the day are not as good as they were yesterday, even here at our here at the hospital.
Yeah, I thought they were going to be a little bit worse after yesterday, the evening report, but actually we have 12 active infections with 4 in the ICU and 2 on the ventilator. So we're
got
holding
up to 20
steady.
at one point, I heard. So
yeah, and I looked. We do have 20 total, because that's 8 in the recovery period. But I think, and I at least saw at least 15 last evening as well.
Yeah.
So I was concerned like you were.
Yeah, I got a note from Dr. Wild that said, we're up to 20 this morning.
Yeah.
The hospital's full, so it's like,
Yep.
Well, we'll see. We'll keep a watch on that.
I think we're always concerned, but we are always ready. We're always concerned about capacity, vital drugs, ventilators. Right now, we're not in that problem or that state, but certainly we know that cases are surging in the United States in general.
They are surging.
Yeah.
Isn't that in some states more obviously much more than others? And it's interesting, there's an article that I read this morning that talked a little bit about how different it is that group gatherings outside. I think we were really worried about Florida in spring break and the crowded stadium for the Texas Rangers baseball game and other things. And it's looking more and more apparent like some of those activities outside aren't as bad as the activities inside, at least when a number of people are vaccinated or have had COVID.
Yeah, and we know the inside is really the main
the main deal
issue in all of that group gathering. So Hayes has 3 total with 2 active and 1 in recovery. And I know you were a Star Trek fan, but you really seem to me like a Mork and Mindy kind of guy.
Okay, so I may have liked that
I think
as well. I can do that.
Associate that a little bit easier.
I do some of my imitations, but they don't go very well. But that was a great program as well. Another goofy kind of person. Yeah. So J&J, we heard yesterday morning when we were talking with Dr. Satterwhite, who was here, and it was like, we hope for a couple of days, and then last night 2 weeks.
Yeah.
What do you think that means?
For
a pause.
I thought the pause, when they were saying it was a couple days, I thought that was pretty rapid.
Yeah.
Again, we only know of 6 cases, and we know that all those investigators for the CDC, FDA, and the Committee on Immunization Practices, we're all going to deep dive and investigate those things. But I think they still want to get more information, and I think that's a good thing. I think just pausing for 48 or 72 hours is probably a little bit rapid. But they are doing it, again, out of caution, wanting to get all the information that they can.
I think that's it. I think they probably found some signals. They need to go investigate those signals, make sure what it means, and have a chance to gather the information. And it takes more than 2 days to do that because you have to make sure that everybody's aware of what to look for and then to report it. Because if you didn't know what to look for, you may not be reporting it. And so now you got to know what to look for. So I think that's very helpful. All right, so before we jump into our discussion this morning, let's see if there are any reporter questions.
I don't think so.
We're not hearing any. All right,
Cody,
awesome.
I hope you're well, brother.
Cody, Taylor, what's going on out there? Dr. Southwick, welcome to our program, and thanks to all of you for being with us this morning. We know you got a lot of busy things to do, but this is a great thing to talk about, and I think sometimes we probably need to spend more time talking about the impact on kids, and clearly the COVID pandemic has done that. So tell us, Dr. Southwick, about the survey you sent around. What did you ask about prom? What did you learn? What are you thinking today? I think you may be muted. We can't hear you. It's only a year into the pandemic. I do that all I can. Go ahead. Let's see if we hear you now.
That's my live.
Much better. There you go. That's awesome.
Yeah, this is probably my 150,000 Skype or Zoom or Google Meets or whatever. But before I get started on the survey, I just want to thank you, Dr. Stites, Dr. Hawkinson, all the staff at KU. You know, you have helped us through this process, being connected, giving us the real data, being able to kind of squash the things that aren't true, being able to look at facts and know that that was going to come to us on a regular basis. And as we've worked on the front end of this thing a year ago, to ramp up to where we were over the last year, and now hopefully we see a little bit of the light at the end of the tunnel. We can talk about that today. But you guys have been steadfast in the information. I just wanted to make sure that we took the time to thank you all. I don't know whether you hear that enough or you can't hear it enough, but thank you very much.
Well, you're very kind. You're too kind. Like we say, we're not going to be flapjacking. No flapping our arms and jacking with the truth.
That's right. As we have done throughout the course of the pandemic, we've tried to align our school districts, keep them working together, being able to answer questions, being able to kick ideas off of each other, and actually have done that with cooperating school districts, 32 school districts on the Missouri side, but we've got colleagues on the Kansas side too that have been right there with us, trying to work together to make sense of this thing. I will tell you, as we talk about prom and graduation today, when we got into this, we spent a lot of time in discussion and a lot of time in terms of policy about how do we ramp up mitigation strategies of wearing masks. And that was difficult for some people to grab, still is for some people, but not so much for our schools anymore. And how do we social distance, and what are our curriculum programs going to look like, and how do we make sure that kids wash their hands and do all the things we need to keep them safe? Now we find ourselves on the back end of this, where people are feeling a little more comfortable about us coming to the end, having to have those same conversations. And that is, we've got to continue to social distance. We've got to wear our masks. We've got to continue to keep kids separated, wash their hands, stay away from large events. And when we go to large events, look at the situations that ran and the numbers that are there. So we're coming down on the backside of it, but a lot of it is the same. But it's really fun to talk about proms and graduations because although graduations were held late last year, they were all over the board. Some took place in July and August. They weren't typical graduations. Most of the proms got canceled. And for a senior and a high school age kids, that is a big deal. So our school district started probably January and February, working with their staff and their students to come up with ideas where they could make sure they provided these experiences for their students and for their staff and their communities. So when we look at prom, we sent out a survey about April 8th, knowing that we had some proms that were coming up fairly early. Like everything else, our superintendents and were interested and staff interested in what other districts were going to be doing. And what we found is there were commonalities, but there were a lot of differences too. I would say the commonality is around mitigation. People are still taking it very serious as we provide these opportunities for our students and our staff and our communities. So we make sure that they're safe. So I'll get into proms a little bit. Our earliest prom on the Missouri side is April 17th. And as I look across the survey, the last one is June the 2nd. We have large school districts with multiple high schools, and we've got some smaller rural school districts that the number of seniors, the number of students that they'd have at these proms would not be very many. So they're able to probably mitigate them a little bit differently. But you're seeing things like proms moving to outdoors, not having a typical prom. One of our school districts taking students down to Union Station, and through cohorts, they'll go to different stations and they'll get pictures taken. We see some of our schools are moving to a less traditional prom, maybe going out on a sports field. Most of our schools have the big screens now, having a movie night where they can keep the kids separated, where they have an opportunity to be there. Some are doing promenades, not having a dance, but where they'll do a red carpet where they get to honor those seniors that are leaving and the couples. Many of them are looking at only seniors being able to come to the prom. And as I look across, all of our school districts in the area that I know are providing some kind of activity for our students. A lot of our school districts, I think you'll hear from Nicole a little bit later on, have thrown this to the students and said, what can we do in this non-traditional setting to give you an opportunity to plan for what might be special for you? So we've had a lot of student involvement across our districts as well. Many of them are going to be held in the gyms as well, particularly the smaller school districts where gyms are generally the same size, but less students means that you can mitigate. But to a T, I can tell you that the administrators and the students have not kind of thrown aside mitigation practices so that they can have this event. They're going to do everything they can to make sure that they're healthy and they're safe and be memorable for our students.
Sounds like some pretty good work, and a lot of people spending a lot of time trying to think through that. So, Dr. Gilhouse, I think Shawnee Mission is among the first to hold their prom this year. What's your prom going to look like in the Shawnee Mission School District?
Well, I hope it's going to be some sense of normalcy for our students. You know, we've unfortunately had to say no to our students way too often this school year, for the past year. But the kids have continually gone to the administrators, what can we do, what can we do? And we're excited about putting a plan together for prom. So the principals would come to me, and I said, let's work with the students and have them put together their best ideas and suggestions, thinking outside of the box of what prom could look like. You know, it could be outdoors, it could be in a large area indoors. And they went back to the kids, and the kids came up with some great ideas. And so the schools put together proposals. Those proposals then came to me, sat down with the superintendent, and we'd review them and we'd say, we can do this looks great, but this here, we need a little bit more work on this part of the plan. And so we'd go back to the students and back to the principal, and they'd refresh it and they'd get it cleaner. And we wanted to make sure we could meet all the mitigating measures. So we went back and forth probably 3 or 4 times with all 5 of our high schools, and we came up with a plan for each building. And it looks great. It's not exactly going to be a traditional normal prom that I think our juniors and seniors are used to, but it's a good plan. And we've got 2 of them that are going to be at the Union Station, the Grand Plaza, which is 24,000 square feet. The 2 schools that are going inside, they're having staggered times where a portion of the students are coming during this time period, and then they will exit, and another portion are coming a little bit later. Communication's been a constant with the students and with the families, letting them know what we're doing, what our plan is. And then we have 3 of the high schools that are doing them outside. 2 of them are going to do them on the stadium, artificial turf with the large screen and the DJs. And the other one's going to be at Shawnee Mission North in what they call their Rose Garden, which is an outdoor facility. We're still going to have red carpet walks. We'll have some prom courts. There will be music. There will be probably a lot more line dancing taking place. The students have worked with the DJs on the music selection. There will be no slow dancing. And so we've had to hire some additional staff to come to make sure that we keep the social distancing appropriate. And we really just want to give the kids a good evening, and hopefully they can, again, get some sense of normalcy and enjoy their junior, senior prom.
Line dancing. Okay, now that's kind of a hoot. That could be really fun. I know I'm sounding like I'm old with that, but that could be really fun. So Nicole, what's going on up north for you guys?
Well, at Park Hill High School and Park Hill South High School, we've really empowered the kids to kind of come up with their own plan. And so at both schools, we had students who developed a plan to make a safe plan for them to really enjoy this, that, like we have heard before, has been taken away from them in the past. So we've got them, they're going to have them outdoors at their stadiums. And they are going to be sitting for a boxed dessert or a boxed dinner, but they'll stay in these little pods with the people at their tables, and they'll have up on the screens their senior superlatives, and they'll talk about their prom courts and their courtwomen courts. They'll have bigger courts since they didn't get to have that earlier in the year, and they'll still have the opportunity to dress up And so that was something that they came up themselves because they really wanted to have this opportunity, but they wanted to do it in a safe way. And so they came up with the ideas, and we were able to empower them to kind of take ownership of this process so that they could still have this experience. So they're looking forward to it, and we're kind of proud of what they've come up with.
That's pretty cool stuff there.
Yeah.
Do you guys think this is going to become part of a new tradition, or is everybody going to want to run right back to how it used to be? What do you think?
That's a good question. I think that, again, it's something for the kids to help have input into. But I think with a lot of things throughout this pandemic, we have taken what we can learn from this experience and see what we need to take forward into post-pandemic life. So it'll be interesting to see what we take with us.
There will be. Joe Gilhouse, I saw you start to talk too. What are your thoughts about that question?
Oh, I do believe the kids are want to go back to the way prom used to be. I would feel very confident in that.
So, Kenny Southwick, you have also done something around graduation. What kind of answers are you getting back? What kind of questions did you ask?
Yeah, so simple questions, the basic questions: what are your plans for graduation this year? Will you have an outdoor venue? Will you have limited tickets? Will it be an indoor venue? And then any kind of comment they wanted to make around that. And then we looked at the dates that they were going to have them. And again, knowing that not too many graduations happened last year in the normal times. They were spread out over the summer. Some people had drive-by graduations to pick up their diplomas. Some went to venues. Interesting with respect to your last question, Doctor, about will any of those things continue on? I think you've seen many of our school districts, as I look across the survey, that have gone to outside venues that have been larger. And I think they might stay with that. Give you an example of that. Children's Mercy Park was utilized by several school districts last year. They're doing that again. And what I'm hearing is they're going to continue, because that's a venue where they can put a lot of numbers of people in, not have to worry about mitigation. One of our school districts, I believe, has negotiated with the Kansas City Chiefs to hold all their graduations at the stadium so that they can space people out, use the big screen, and have a safe event. And I'm hearing that if those things work well, they will continue on. It is, particularly with the indoor events on the larger schools, they're going to do that. You're going to see limited tickets. And then the outdoor events always, and it's been this way forever, rain happens in the Midwest in the spring, and you always have to have a backup plan, and our principals do a great job of that, of giving families and graduates tickets so that those important members can be there. But at the same time, they have backup for video systems where they can either live broadcast that, similar to what you're doing today, or they can make videotape or have a link of that so people that can't be there will have an opportunity to be theirs. So that's, we think graduations are going to happen and going to happen on time. They will look fairly similar, other than, again, a lot of attention to social distancing, wearing masks. The mitigation, as I'm hearing it right now, is just not an option. You're going to do it if you're going to participate. And I know that's consternation for some people, but it's just what we deal with.
Well,
we can't make everybody happy, but we got to make everybody safe.
Well, and I think that's right. We were just talking before we went live this morning about Hawk. You had spent some time in one of the long haul clinics and talking to Leslie Spikes from pulmonary lung disease. Yep. Those guys are busy with long haul patients, and they're not all old.
Yeah, exactly. We opened it up just to health system patients and now to everybody, and there has been an overwhelming response from the community about needing to get in and be seen, and that's just for the pulmonary, the lung aspect of that. They now have 3 doctors that are helping to evaluate these long haul patients. So it is out there, and young people are susceptible to long haul symptoms, and you don't have to be critically ill, but just have even mild or moderate symptoms to even get some sort of long haul symptoms. So that is an issue. It's not just the acute illness and the sickness, but it is what can happen after you recover.
Nicole, as you look at the graduation, how does it look up north? Uh-oh, don't forget to unmute.
You'd think we'd learn. So we're going to do what we did in July for the class of 2020. We're going to recreate that for the class of 2021. So again, it's going to be, as Kenny said, at Children's Mercy Park. And we found that our families loved that, our kids loved that. It gave them the opportunity to have this experience in a safe way. It's outdoors. They're able to separate. We had the big screen up there. We're even able to live stream it to people who weren't able to be there. So it was just a really nice setup, and that's something that we're carrying through this year as well. So I think that people are looking forward to that.
That does sound like a hoot. I would have to say, what a hoot to be at sporting.
Yeah.
I call it sporting, but at Children's
That would
Mercy
be
Park
great.
to do that. Dr. Gilhouse, your thoughts?
Our graduations aren't going to look a whole lot different. They'll continue to be outdoor venues and be at our stadiums. We have the big screens. It'll also be streamed live. We'll move the chairs 3 feet apart where the students are sitting out on the artificial turf, and our choir members will be 6 to 9 feet apart where they're up kind of by the dais, as well as the band members that are playing will be 6 to 9 feet apart for their roles. But other than that, we'll be giving 6 tickets for each student to share with their families, no more than 6. So we'll do the social distancing and communicate with those families as to keeping the safe spaces between them as they're up in the stadium, watching the graduation. But other than that, it's not going to be a whole lot different.
Awesome. All right. Well, let's turn and see what questions are out there from our community, Jill.
Sure. We have 3 that are on topic, and then we're going to kind of segue into some vaccine questions. But the first question goes to Donnie. He is asking, with sporting events, the doctors have said that it's the pre and the post activities that concern them the most, not the actual game or event. And so they're wondering, what kind of coaching are you giving to the students for these proms and graduations about pre and post?
Pre and post. All right.
Yeah,
Nicole, what do you say
100%.
to your students
Yep.
about that?
Well, while they're there, they're going to be wearing their masks, and they're going to be distancing. They've all been educated about pre and post. There's so much that we can do with what they do on their time. And that's not time that we control, but we definitely want to make sure that they have all the information they need to be safe.
You bet. Dr. Gilhouse?
Similar to what Nicole mentioned there. And so all of our students will also be going through QR codes before they enter. They'll all be wearing masks. We don't have any outside guests that will be coming to our prom. So we've communicated with them up front over and over again. I'm sure they're probably tired of hearing it. They're like, we got it. It's going to be fine. So I think they're ready to go. I think they know what the boundaries are and the guidelines, and I think they'll follow them. It's going to be a great night.
Kenny, what are you hearing from across the area?
Yeah, I think one of the things is that people need to remember we have a big event every day. Most everybody's back now face to face. And as we talk about what it takes to get up in the morning, ride a bus to school, to be safe, and what it takes to get home, and what you do in and around your neighborhood environment, those are things that we talked about all year long. And I think they apply to proms and graduations as well. And we just have to hope that the educational process and the working we've done happens outside of the school environment. Having said that, we know that over the course of this pandemic, a lot of the cases that we've dealt with in school haven't been transmitted at school through our tracing. It happens before or after. So we just have to stay diligent and keep the foot on the pedal. Don't let up.
Agreed. Okay, Jill.
And Cindy just had a curious question. She feels for the seniors from last year, and she wants to know if they're going to be invited back to any of the prom events this year.
Guys, I just opened up. Anybody inviting the seniors from last year back?
We're actually keeping it very close. What the students have decided is it's going to be just the juniors and the seniors, and it's not even going to be students from outside schools invited. So,
There you go.
I think Kenny brings up a good point. The reality is a lot of these students are getting together outside right now. But I think the thoughtfulness of the schools and school districts going into when we know we are going to have a mass gathering, what can we do to help mitigate the spread and the risk of that? And it's spread to the patient, to the children, to the students, but also to their family members and other people who may be more at risk of severe disease. So I think the thoughtfulness there has been really good from what we've heard.
All right, we're moving on to some other things, and if you have
right.
questions for our panel, go ahead and conclude those. Michelle wants to know, she says, do you have any updates on trials for treatments that can be given in the first few days of symptoms? And Dr. Castro is going to be back, but it's not till May 13th. But
Yeah,
he is.
we'll get it then. But in the meantime, the trials are ongoing. Huh?
Yeah, trials are ongoing. You know, he would certainly be the expert. He's helping run several trials here at the health system and on the university side. There are still those trials. There's the inhaled interferon, which is a chemical that our immune system secretes to respond to viral infection. There are trials for oral antiviral therapies, something like we can use like Tamiflu. But I don't think there's been any major updates or any results from those trials right now. And there continue to be things ongoing as well.
Yeah, but I don't, like you, I don't think there's anything that we know new that is out there. I did see some interesting stuff that came out, information that came out, I want to say it was a little over a week or two ago, saying that the Regeneron product looks a little better than the Lilly product for the antibody therapy, in that it seems to help prevent transmission in households, especially if you're high risk, you're around somebody that's been sick, you could get the antibody infusion and then you don't get COVID. Are you?
Yeah, you know, that is great. And the FDA does have their website up, and they have informational forms there as well when they do also look at these monoclonal antibodies against some of the variants. So that's very important to understand too, is sometimes these monoclonal antibodies may not be as effective against some of the variants, but the press release from Regeneron was, or I think it was even a publication in the New England Journal of Medicine, that showed that if you have somebody who's ill in the household, if those household contacts can get this subcutaneous or subdermal deposition of these antibodies, it can actually protect them against disease, and therefore you also will prevent spread of the disease as well. Now, I think the big thing with this is access to that. I don't think really any place has very good systems or protocols because this is so new. I don't even know if we have the actual formulation, but getting access into those systems. But I think it is something that's going to be tightly regulated. It has to be, just because we understand that some of them may not be as efficacious against the variants. So I think it's going to depend what are the variants like in your local community.
Well, I think the Regeneron product did seem to work pretty good.
It does,
so
right now.
As mentioned, the Lilly, so that's pretty exciting. But of course, the best way to protect yourself against the variants and everything is to do what, Hawkeye?
Mask.
Distance.
Not meet in large gatherings. If you have to do things and meet with other people, please do it outside, and that will, along with the distancing out there, of course.
Wash your hands, and the
get
big
vaccinated.
V word, get vaccinated.
Especially if you're 16 and above, get vaccinated.
Man, there is nothing that beats vaccination.
Michelle also had a question about in-home testing and the rapid tests, whether you think they're worth the money and effective.
What do you think?
I did notice a place on 151st between, I think, Metcalf and Antioch. Big building said rapid testing. Those might be popping up places too.
Yeah, you know, I don't know about the pop-up thing. The all testing has gotten a lot more accessible because there's a lot less demand on it. So the turnaround is a lot faster. The in-home kits, what are you thinking?
Yeah, you know, I think there's not enough information about it. That is one theory. If you can do an in-home test once a day or once every other day, you may be able to head off your ability to transmit the disease or even identify infection earlier. But I think there's still, you know, not enough information about that. And what is the accessibility or the cost? I don't think every household is going to be able to be doing testing every day or every other day. So,
or get vaccinated.
Right. And then you'll be, exactly.
Yeah. Get vaccinated. There's that V word again.
Yeah. Tobias has a question. He says, if you are allergic to the ingredients in any of the vaccines, how will a person be able to live a normal life? So I think there's a little anxiety. Maybe he's fearful.
You know, I think we have to be careful because the Moderna and Pfizer, we're not seeing a lot of allergic reactions.
No.
Not a hypersensitive, I'm going to have anaphylaxis reaction. Now, there are a few people who do have that, and they have a history of anaphylaxis to vaccination. And I think there are things you can do. You need to talk to your physician, especially if you are seeing an allergist. Talk to your allergist and ask them what are the things you can do to safely be vaccinated. Because we do vaccinate people who have a history of anaphylaxis to flu shots and other things, but we take certain steps to make sure that they're kept safe. And we observe them for a longer period of time. We make sure they have EpiPen. So I think you can get vaccinated.
Yeah.
If that fear drives you, if it's too big of a concern, or you've had too severe a reaction, your allergist says, gosh, this is too dangerous for you, then I think you have to do all the mitigating features until other ideas come along, meaning that there are other types of vaccinations that are being developed, like the Novavax vaccine. That's a different vaccine system, and so we'd have to rethink about, and I think that's going to get approved. I think that's going to work. And so I think there will be other opportunities for different kinds of vaccination than what you may have experienced. Hawkeye?
Yeah, I mean, for these vaccines, specifically for Moderna and Pfizer, I don't necessarily remember Johnson & Johnson, but there's only 9 or 10 components in that vaccine. There's no preservatives. Some of those components we have exposure to every day, stuff like the polyethylene glycol, which is in Miralax, which is a common type of medication that a lot of people take. So if you do have those allergies to those specific components, I suspect you're seeing an allergist because they are so specific. Talk with your allergist, but there's also been a recent publication, I forget whether it was Annals of Internal Medicine or JAMA, that they are actually able to continue to give you the vaccine, but they just do it in small graded doses. So you eventually end up getting the full dose, but it's not the full shot in the arm right there at that 1
So it's like
second.
a desensitization regimen that we use for other medications, because we do exactly that. I didn't see that. That's great.
Yeah.
Jean-Paul and Melissa have kind of similar questions. They want to know about infection after vaccination, and Jean-Paul is specifically asking, have we had people admitted who had been fully vaccinated?
Well, that's a great question, Jean-Paul. I like just saying Jean-Paul because that sounds cool. It rolls off my tongue so cleverly.
I love it.
Yeah, it's very good. Melissa, you have a cool name too. Didn't mean to short that. So what do you think? Are we seeing patients being admitted after vaccination?
Yeah, I think we talked a little bit last week that there were 3 patients that were fully vaccinated, so that's 2 weeks after your vaccine, your second dose, or your first dose of Johnson & Johnson. That were admitted. We had, I think, 2 of the 3 were asymptomatic. They were here for totally other reasons. The other one was symptomatic, but again, I don't know the details of that exact case. I don't know if it was the symptoms that brought them or something entirely different, and they just happened to have symptoms. But
so in other words, we do screening.
They were
so
caught
if you're
on the
coming in
mission
for an
screening,
OR procedure or something like that, or having surgery, we might screen you, or you come in for a totally different thing, and you may get screened. Like you're in a car accident, we screen everybody. So that's why that can happen like that.
Yeah, and we know from the early trials that you can still get infected, but overall, what these vaccines are going to do is reduce your spectrum of disease. Specifically, one of the endpoints they were looking at, the Moderna or Pfizer, was just looking at symptomatic disease, any symptoms whatsoever, and there was a significant reduction in there. Also, later on, we find out there was also a significant reduction in asymptomatic infection as well. So we know you can get infected, but overall, your spectrum of disease and the symptoms you may have are going to be significantly reduced after the vaccines.
So Mary says that her pediatrician said that my healthy teenagers should wait 12 to 18 months to get the vaccine to make sure that there aren't side effects. She wants to know if you agree about kids 16 to 19. Should they wait, or should she go ahead and get them vaccinated?
Yeah, I think, I would defer to our colleagues and to Hawkeye, our colleagues who are at Children's Mercy, who have looked at this very closely, and I don't think they're recommending waiting at all. Yeah. I think they're saying you need to get vaccinated. That's what's going to keep you safe, keep your household safe, et cetera. And plus, we now have a very if you think about Moderna and Pfizer started their trials almost a year ago. So we have a lot of data, Moderna and Pfizer, and man, it just is looking really good. And I think, I don't think people should wait, Hawkeye.
No, I would agree with you. I think, the Children's Mercy Group, and again, also with your specific pediatrician, I don't know what's going on with your children, but overall, there is a vaccine approved for 16 and over, and I would certainly recommend that. That may help them get back to doing more things. Also, if they do get infected after vaccination, it will more than likely reduce the amount of symptoms they have, but also their chance of getting long haul symptoms.
I know, and that's not exactly.
And you don't want a 16-year-old, 19-year-old young person to then have 3 or 4, 6 months or more of fatigue, weakness, maybe brain fog. We know adolescents, their brains aren't working normally anyways with everything that's going on in there. So, Yeah, I think the recommendation is to get the vaccine and not do that waiting.
Yeah, that's what I would be saying to my children. Actually, my children are older than that, and they've all been vaccinated now, and I'm thrilled about that.
Yeah.
And I was not. Don't hold back. And you saw us get the Moderna vaccine here on our program, and man, when the booster comes up, I'm ready to go. And I think that when you've been in medicine for a long time, you see new therapy a lot. And you have to just judge the risks and the benefits. And I think the risks of Pfizer and Moderna are very, very low. Now, I know there's a concern about the J&J vaccine, but as of what we know right now, it doesn't appear to be a very significant chance. If it happens, it's bad. It can be bad, but it's a very low chance. And I'll just say, if you're not vaccinated, the chance of getting or dying from COVID is much higher than the complications from the J&J vaccine. We know a lot more about the AstraZeneca complications, and it's clear we can say that. So.
And I absolutely would not want any of my children to get that multi-system inflammatory disease.
No, that's really
those children
bad.
can get. I mean,
and post-COVID clinic is bad.
Multi-organ damage, yeah.
And you could be 2 months out of your COVID infection and then get sick. You're like, why am I sick? Well, because you had COVID 2 months ago. And that's tough.
And there is no evidence that happens with the vaccines.
Yeah.
Two quick more questions. But first, Jean Paul. He said, thank you for taking his question and giving an answer. And he said, and my mom will love that you pronounced my name correctly.
Yeah.
That was by mistake, Jean Paul. Don't give me the credit.
no,
for
we-
that.
Reggae Jean Paul by any chance?
Okay, last two questions for this morning. One of them is, we have concerns about male infertility with the vaccine. Could
Yeah.
you please address it
It
versus
doesn't happen.
COVID?
Doesn't happen. That's just not true. You can talk to Kevin Alt tomorrow.
Completely false.
Well, we're gonna put a plug in for the program now. Kevin Alt, our OBGYN doctor, who's on the advisory committee, will be on the program tomorrow. We're gonna be talking a lot about J&J vaccine. That does not happen.
Male
Okay.
or female infertility does
exactly.
not happen.
So
Okay, and then the last question is from Sherry. And I had another person that I sent a question to Dr. Hawk about. So this is why I'm going to say it. They got the shot differently. Like they squeeze the arm and they're reading, you shouldn't squeeze the arm. The shot needs to go between one muscle and another place on your arm. And now they're worried that the shot is not going to be effective. Can you speak to that?
it's gonna work, Hawkeye.
I think it'll work, yes. That is the short answer is it'll work. You are still getting that vaccine delivered into your muscle cells. Some muscle cells will take up the nanoparticles, the other parts of the vaccine that is not taken up by the local muscle cells will then drain to the lymph nodes. That's where the immune system and the immune reactions are occurring. So it will be okay. You know, there's probably more optimal areas to inject if this was really truly an issue, but it's still going to work, yeah.
And it was her second shot, and Mom says she didn't have any symptoms. And
Yeah, that's
so I'm
great.
worried
Lucky
it's not
for her.
working.
No, should be fine.
All right. So as we wrap up today's program, a quick plug about tomorrow. Tomorrow is Follow-Up Friday. We answer your questions.
Yeah.
Dr. Hawkeye and Dr. Wild will be here tomorrow. Many questions continue, though, about the J&J vaccine. So Dr. Kevin Alt is back on our program tomorrow. You recall he's on the OBGYN docs we mentioned just a moment ago. He sits on the advisory committee for immunization practices. He's bringing data as well as insight around the committee's recommendation to the CDC and the FDA about the J&J vaccine. He'll be well positioned to help us answer questions. That'll be a good program. Wish I was going to be here, but I have to do, I get to do some medical clinical things, taking care of patients. So let's go back to our panel and ask them if they have final thoughts today. Dr. Southwick. You're muted, Dr. Southwick. We got you. You're muted.
See, 2 times in one show is horrible.
It's all right. We all do it.
That's the way I am.
My wife likes
No.
the mute button on mine. She just keeps muting me.
No, that's good. I just, again, thank you. And I want to thank Joe and Nicole for taking time because I know they're both busy. And really all of our school administrators, our teachers, the lunch ladies, the bus drivers, you know, everybody that we've got out there, our board members, community members that have been in tough times compliant and have helped us pull this thing through and continue to educate kids. And it's nice to see the light at the end of the tunnel, but again, I'm going to reemphasize, it's not time to take your foot off the pedal. Got to keep working on it.
You bet. Dr. Joe Gilhouse, final thoughts from you.
I appreciate you having us on the show today. It's very kind of you, but I did want to put one little plug in. Next week, we begin vaccinating almost 1,500 students in our high schools, 16 and up. So we're excited about that.
That is awesome. All right. And then lastly, Nicole Kirby, how about final thoughts for today?
Well, thank you so much for having me. And I guess I'd say the same thing. We are excited to partner with the Platte County Health Department to provide an opportunity for students 16 and up to get a vaccination. And so that's something that they're providing to students across the Platte County. And we're really excited to be able to give people that opportunity. And we also appreciate the partnerships that allowed us to provide vaccine to our staff to make our schools safer and to make people feel safer. So thanks so much.
You bet. And we want to thank all of you and all the folks who have been working so hard to get kids back in school and get kids safe. I think it's very clear that the amount of the emotional toll and mental health challenges that occurred to adolescents and to students over the pandemic has been extraordinary. And we know it just here in our own health system because we see it in our sick calls and our hospitalizations, et cetera. So we really appreciate that y'all have done such a great job at getting schools reopened, keeping kids safe, and trying to get a sense of normalcy back into lives. That is a massive undertaking, and we are deeply appreciative of your efforts and all of the teams that have helped support that. So thank you. Hawkeye, final thoughts?
Yeah, I'm glad to hear that we are at a place locally in the pandemic here where we can do proms and graduations, things of that nature. Lord knows I would have hated to miss my prom with Karen Zagunis. So it sounds like there are thoughtful manner.
Wow,
I know it's a thoughtful manner that these school districts and schools are going about to try and keep everybody safe. And I think the systems and protocols they have are good. And hopefully it is actually one good memory that these young people can have in light of the pandemic that's going on.
Yeah, I was too shy and too nervous, so when my friends had asked Barbie Ford for me
there you go.
go to parties, she was very kind to go, and one of the nerdiest guys in school. So we want to thank all of our audience for tuning in to the program. Again, we have a great program tomorrow. You know, it's interesting to hear us evolve, and we are evolving to what the new normalcy will be. And it's a fascinating discussion, I think, with our representatives of the schools today, is to hear how they're trying to create normalcy and but that word create is really important because using our creative intellect and our abilities and turning things over to the students has helped to create what a normalcy can be, and we can all be a participant in that. As we look across all of our lives, we're going to have to seek out what that normalcy is going to be and how we all feel more comfortable. But here's what we know. If you want to get closer and closer to normalcy, the only way to truly achieve that is to be vaccinated. Moderna and Pfizer especially, in the United States, we are just blessed with now an abundance of these two vaccines. You can be vaccinated. It is safe, and it will help drive us toward becoming more normal. And whatever that looks like, we're all going to have to find it and seek it together. But the only way to get as close to what we remember so that the future looks more like the past is to become vaccinated, because that is how we stay safe. We'll see you tomorrow.